Okay, at 12 a.m. this morning, Lewis County declared a state of emergency in response to the COVID-19 pandemic. The primary reason for the state of emergency declaration is that it allows schools in Lewis County to close for social distancing without losing critical state aid. The state of emergency declaration also gives the county access to additional state and federal resources to serve our community during this pandemic. The state of emergency does not indicate an immediate threat to public safety. At this time, there are 0 confirmed cases of COVID-19 in Lewis County or anywhere in the North Country. To date, Lewis County has tested 5 individuals, 3 tests have come back negative, 2 tests are pending. Social distancing strategies, such as the closure of public schools and cancellation of public gatherings, are not indicative of an immediate threat to public safety. The implementation of these measures now will help will help ensure public safety in the long run. These small sacrifices in our day-to-day lives are statistically proven to help protect the most vulnerable members of our community, which we all can agree is a goal worthy of our efforts. Protecting, informing, and serving the public during an epidemic is a very basic function of government. Your county government is working hard, and we are determined to be at our very best in the weeks ahead. Due to the Governor's Executive Order 202.1, the declared state of emergency in Lewis County in response to the COVID-19 pandemic, and an abundance of caution for residents of the county, the legislative committee meetings being held tomorrow, March 17th, 2020, beginning at 1:00 p.m., will be closed to the public. To the extent of its capabilities, the county will make every effort to stream the audio and video of these meetings, and will also record the meetings and post the same on the county website as soon as possible. The county will also transcribe the minutes of the meetings and make them available to the public. Lewis County will also be abiding by the Governor's executive order to reduce staff by 50% in order to further social distancing efforts in New York State. Effective tomorrow morning, non-essential county staff have been directed to stay home. To be clear, all essential public safety, public health, public transportation, and public welfare operations will continue to serve the public at full strength. Lewis County Health System will also continue to operate at full strength. County departments will continue to serve the public despite the reduction in staffing, but the public is advised to call ahead if you require services from the following departments: County Clerk's Office, County Treasurer's Office, Clerk of the Board of Legislators, Building Codes, Community Services, County Law, District Attorney, Human Services, Civil Service, Office for the Aging, Planning Department, Real Property Tax, Recreation, Forestry and Parks, and Veterans Affairs. Additionally, at the direction of County Clerk Jake Moser and at the advisement of Public Health, the Department of Motor Vehicles will be closed until further notice. We encourage the public to abide by the intent of the Governor's executive orders by avoiding public gatherings and public spaces, including government buildings. County facilities are not closed to the public, but people are encouraged to conduct as much business as possible by phone or by internet. Per the Governor's directive, these social distancing measures will be in place until Tuesday, March 31st, 2020. At this time, we'll take any questions.
For Mr. Cayer, in terms of the hospital, can you just update, Ryan's kind of read through some of the county procedures. Can you just update us what the visitor restrictions are at the hospital? And is it business as normal, or are you guys canceling elective surgeries and things like that?
It's business with adaptations. The restrictions in visitors is primarily geared towards the nursing home. The staff at the nursing home are all being screened to ensure there's no fever, no active cold symptoms. Elective surgeries have been postponed for 1 week, but not related to COVID-19. One of our anesthesiologists of 2 has the flu, and we were unable to secure the services of the 3rd when we found out. So yes, electives are delayed or postponed, but not related to COVID-19. And we, 2.5 weeks ago, put together the COVID-19 action team. We've been meeting for 2.5 weeks in a very planful, disciplined, purposeful way. We've engaged with our colleagues here at the county manager's office, emergency preparedness, public health, and really trying to develop an approach that appreciates the totality of all of the services that are potentially impacted, and working together so that services and resources are used efficiently.
And as an organization, do you feel that currently, with the plans in place and things like that, that the hospital has an adequate supply of things like PPE or personal protective equipment and things of that nature for staff?
Yes, we do. We, basically we have these burn rate calculations for all of the different medical supplies, and we've done that. So we are okay for several weeks out. We've already put in our order with emergency preparedness to the state stockpile, and we are working with our vendors. Of all the things that we worry about today, for example, that was not one of them. But this is very fluid, and we break the day down into 2 segments, AM and PM. And tomorrow morning, our action team will come together, evaluate what happened overnight, and that will set into play what we will do for the first 6 hours of tomorrow.
Okay.
Are your staff going into the regular hospital ward and the rest of the hospital, are they also being screened?
Not at this point, where we have questionnaires and we're having managers do checks. But for the nursing home, it's a little different. There is very specific state guidance that has been shared with us by public health, and we are implementing it all. People must be screened thoroughly to include temperatures before going in, and residents are not allowed to come out for any level of activity. And there's social distancing occurring within each of the 4 units. So congregated meals, activities, that sort of thing, are done not as a group, but as individual residents.
Thank you.
We also
Go ahead.
We also have Ashley Waite here, who is the Director of Lewis County Public Health. So, Ashley, if you could just provide us with a little bit of an update on current tests that have been done in the county, what the results are. I know we spoke to you this morning, so not sure if you have any new information since then.
So there is a little bit of new information since this morning. We now have 7 individuals that we've tested. 3 are negative, and we have 4 pending at this time. We are currently quarantining 16 individuals throughout the county. These are precautionary quarantine. Obviously, the individuals that we are testing, we are quarantining them in the event that they may be positive. We absolutely don't want them to further spread the virus. So this precautionary quarantine is simply to prevent that spread.
And can you just explain a little bit the process under current protocols? If you do end up receiving a positive test result, what steps go into the investigation process, and do you feel your organization is equipped with enough staff to handle those tasks?
Mm-hmm. So if we have a positive case, we will do what's called contact tracing. So you have the positive person, you go back and you see who they have had contact with. All of those individuals then need to go on quarantine and potentially be tested if it was a close contact. So there's close contact, somebody that's been within 6 feet, and then there's a proximate contact, somebody who has been in the same building as somebody. They would be considered just needing precautionary quarantine. A close contact would then be tested. And we do have enough staff. We have reorganized what we are currently doing. Non-essential services are not occurring at this point. The staff that do those services have been reallocated to doing quarantine. When we do have the contact tracing that needs to be done, I have temporary staff that will come in and do that for us. So we are prepared and planning for the next steps day by day.
Okay. And as people might be getting home from work today and stuff, I'm sure they've heard about it throughout the day, but with some of the new social distancing practices that are taking effect tonight here in New York State, at least with bars and restaurants and movie theaters and things of that nature, can you just explain to people why it's important to, we hear flatten the curve a lot, what flatten the curve means, why that's important, and by taking these steps now, what is that doing for us in the future?
So flattening the curve, any virus outbreak has a rise and a fall with a peak in the middle. The point of social distancing is to prevent the spread of the infection, not slow the spread of the infection. So you will decrease the number of cases, you will decrease how rapidly it spreads, and ultimately enable the healthcare system to adequately care for the individuals that do require hospitalization.
Thank you. I don't want to ask all the questions.
No, I was going to wait till your broadcast done if that easier for you.
That's good. Go ahead.
Okay, back to Jerry for just one question. At the hospital now, today's announcements that you can have more unilateral decisions about how to use your space. Not all of the rules are going to apply because of the governor's decisions. Will that change how you're going to approach all of this so that you have more space?
To a degree. I mean, the fact of the matter is we have a fixed structure with a defined floor plan. So today, a lot of discussion on creating a sick clinic that has its own entrance so that community members don't have to walk through the lobby to access that. And our physical plant, our footprint, supports that. And that's something we've engaged with Ashley and Public Health on, because we want to be a resource for public health, as well as our physician practices, as well as other community physicians. So right now, if all goes accordingly, tomorrow, we will go live with this new clinic on Wednesday, at the earliest, latest Thursday. So that is, not going through the traditional approval process for where clinics are placed. And so that's an example of something very real. I do think we need to evaluate if we implement testing, screenings at the same level of the nursing home for the acute side. We've put a lot of effort into limiting visitations, not excluding visitations at the hospital. And in large part, the science is driving that, because older citizens and residents with chronic disease are more at risk for fatal outcome than a younger individual without the same compromised systems. However, a big part of our goal is to prevent it from coming into the building, because we have a fixed resource here, and they are called staff. And we can ill afford to have a breakout among the staff, or our ability to be of service to the county would be dramatically hampered.
Absolutely. What's our testing capability? How does that work? I mean, we know that there's a statewide figure. Is there a finite allocated amount for Lewis County?
There's not. So there's testing criteria, which all of our providers have, and the providers are ordering tests appropriately. Public Health has the capacity to go out to the home to test individuals that meet the travel history guideline as well as symptoms, and we have done that. So we do have the ability to test. There's no limit on the number of tests that we can do. They just need to be appropriate according to the state's guidance.
With the governor talking about rolling out drive-through testing sites and things like that throughout the state, have you guys been in contact, or have you heard anything about anything specific for Lewis County or the North Country in general?
Not specifically Lewis County, or I have not heard anything about the North Country in general. I will tell you an interesting fact, though. We do have experience with drive-through. We did a drive-through flu clinic in 2012. So our public health staff and emergency management has experience with that sort of thing. We have not been approached by the state at this time to do that. We certainly don't have the volume of individuals presenting for testing at this time.
Thank you.
I think to build upon Ashley's response, I think this is where the system is probably better equipped to partner with public health. Just like we're creating that clinic for the walkthrough on the main campus, if the numbers suggest we should open up another location in another one of our communities, then that's what we'll do. Because drive-by is great if you don't have other options. I think we may have other options in our community.
Meaning your out clinics from
Correct.
South Louis to Harrisville, etc. Great.
We also have Emergency Management Director Bob MacKenzie here as well. And Bob, if you could just speak a little bit to, from a first responder perspective, what kind of extra measures have been going in place with the ambulance agencies and the fire departments and the police agencies as they're exposed out in the public as well?
So the New York State Department of Health has been doing outreach on this for quite a while. They've been very active in putting out emails and also contacting agencies directly to find out what their capacities are. They're held to basic standards for every single run. So PPE, personal protective equipment, is something that's commonly worn by EMS providers anyway. With the new change in social climate, we did have to cancel some fire training classes, but as far as the EMS side of the house, they're very well equipped to handle this type of a situation, and it's common for almost every call that they do.
And I know when we spoke with Ashley last week at Public Health, I think that was last Wednesday or Monday, so a week ago. A lot's changed since then. At that time, I know you were encouraging people if they thought they might be experiencing symptoms but were extremely severe and things like that, that it was better to call ahead to Public Health or to the hospital, make arrangements before just showing up. Don't call an ambulance, that type of thing, if it wasn't severe. Is that still the recommendation? Like, you'd like some notice if people are going to come in presenting those symptoms?
Absolutely. That will decrease the spread within the facility where other patients are. And the health system is, I would say, better equipped with signage to indicate to patients that that is the protocol in case our messages are not getting out there.
Thank you.
Also, the governor discussed today that restaurants and other public places should close at 8 o'clock beginning tonight. Will that be enforced? Is this just self-monitoring? It seemed more like a recommendation. It wasn't a full edict, or was it a full?
It was an order.
Was it? I mean, are we enforcing that?
Yeah. So I think we're waiting for clarification from the governor's office on the exact language of the executive order. I think the intent of the order is to continue the social distancing efforts that began earlier in the week when we, discussed closing the schools, and now with our, county offices, reducing staff. So I think that's the intent, obviously. In terms of enforcement, that's something that we'll have to wait and hear a little bit more from the governor on.
And is that true in general with what's going on? So there's a lot of different, some good, some really controversial ideas coming out of Albany, but some of them seem to be you can pick and choose, and some of them seem to be you must enforce. Is that correct? Is that?
I would say things are happening quickly, as they do in these types of circumstances. We will adjust on a day-by-day basis, depending on the need to execute some of these executive orders. A lot of these things are in response to the situation escalating more quickly downstate. Obviously, we're in a position where we get to prevent an outbreak rather than having to react at this point. But I think each of the executive orders that are coming out of Albany will have to be addressed in time and with a little more detail from the governor's office. So it's hard to say exactly. I would imagine that most of our businesses in Lewis County will abide by the intent of the order without need for definite enforcement from the state.
And how many county employees had to cut by half for tomorrow, right? So as you read before, but how many exactly does that involve?
So we have 284 county employees, so we wanted to get our number down to about 145, which we were able to do. So we've got a great staff. A lot of those people will be available and working from home, which is great that we have the technology to make that possible. To the extent that we can, we are going to continue to serve the public every way possible, but we're going to observe the governor's intent to have some social distancing in our government buildings and create some space between people.
So some of the departments you listed off before where it said you'll still be able to ask questions and things like that, but are we encouraging people not to come in, right? Call ahead for appointments?
Yes.
So things like the treasurer's office, the county clerk, so if you need a permit or something like that, is it, and we actually have County Clerk Jake Moser over here too.
I'll let Jake handle it.
Are we asking people to call ahead and then you guys get the permit ready and pretty much they just come in and pick it up? Or are we
Yes.
encouraging people not to maybe not get permits, or not get permits, you know what I mean, but delay getting their permits and things like that until this passes, or?
We're recommending basically as like an essential transaction, and we've spoken with many of our customers that come in on a day-to-day basis that they realize that all they have to do is make a call to the clerk's office, and our general customers, our abstractors, lawyers, a lot of them actually utilize the e-recording system, so they are actually able to do a lot of documentation on the internet. Same way with the court systems, they utilize e-filing, so we can still do all those transactions. Mainly, what I'm telling other customers is if it's not a necessity, there's no need to come in. If you're going on a trip, there's really no need to get a new passport right now. That can we can wait a couple weeks until you come in for that application. That's not a essential transaction in our minds right now.
Okay, and earlier today we notified our audience that the DMV was going to be going to appointment only starting tomorrow, and then later on in the day it did get changed to the DMV is going to be closed until further notice. So people that, what do you suggest to people if their license is set to expire in the next few days, or their registration, their license plates, things like that? Are there special procedures in place?
Yeah, so the DMV, we do have protocols down at the DMV that, as many people would realize that in the mail you do get renewal notices, so if you want to keep your county money local, you can still mail it in. What we'll be able to do is that all the mail does come to the clerk's office, and on a call-in basis we will be able to have one of the DMV examiners come in to fulfill that transaction and mail it out to you. Or again, with the DMV, there is internet capability that many of the transactions on the DMV are capable of doing it across the internet and fulfilling like a license renewal and like that.
Thank you.
Yep.
My last question is just generally finances. We kind of joked sadly about it earlier, but with the plunge of the market, with interest rates down to zero, and other financial concerns worldwide, as a matter of fact, how does that affect the county finances?
Well, a couple things. In the short term, we are under a state of emergency, as is the state of New York and as is the federal government. So at this time, spending on essential government services and essential services to protect the public, that will not be stopped, of course, in any way. For us, we do rely on about 25% of the county budget, talking in the long term now. 25% of the county budget comes from sales tax. So any downturn in the economy is a concern because we use that money to balance our budget. This is not the type of downturn like we saw in 2008. 2008 was a fundamental shock to the economy based on real estate rates throughout the United States, which rippled throughout the world. This is not that. This is a economic downturn that's driven by our ability to consume products, our ability to spend money, which right now is hampered. So I would predict, well, let me put it this way, I'm no economist, but what I would say is that I think it's reasonable to expect that the market, as soon as things are settled down with this pandemic, I think the fundamentals of the economy are still strong and they should return. Hopefully we can bounce back from a couple bad months of sales tax throughout the rest of the year. So we're still hopeful on that front.
In my last question, I would just like to go back to Ashley, or maybe Ryan could address this too. But just in some polling data that we've seen lately and just kind of comments and reactions that we've been dealing with internally, what would be your message to people that say they're really not worried about the coronavirus or the spread of the COVID-19 or that things are kind of a little overhyped or things like that? What's your one takeaway for people to understand? I know we talked about it a little bit when we were talking about flattening the curve and things like that, but what's your overall message for people to take away what they should be doing right now as social responsibility?
So I do feel individuals need to take this seriously. There is a certain level of panic that I don't think is necessary. I think you need to take the facts and apply it to your life. And like you said, be socially responsible and abide by these social distancing efforts. A lot of people have been comparing this to the flu, and this many people die of the flu, and we're not seeing those numbers with COVID. However, COVID-19 is not widespread currently. It is becoming that way, and that is the reality that we are in right now. So that is why we must take this seriously and do everything we can so that we do not get to the point where it is as widespread as the flu. Because as we know, to date, with what we know about this new virus, the fatality rate is higher than that of the flu. So we need to do everything we can to keep those numbers down.
And I'm not sure, this is kind of just like a follow-up along those same lines, and I'm not sure out of all of you up here who's best suited to answer it, but maybe Mr. MacKenzie. As far as are there recommendations for people? Obviously, we've seen a lot of store shelves kind of running low on things and things like that. Is there a time frame, people should just buy a week worth of stuff at a time, or do your normal shopping, or do you have recommendations like that for people, or?
Bob buys a month ahead.
Well,
common sense?
I would absolutely use common sense. Clearly, our stores have been overshopped at this point. Give it a week or so to bounce back and be able to, obviously get the stuff that you normally need. Live your life, as you normally would. Most people have plenty of stock right now, and those, that's actually a good thing. With the children home, on this extended break, as well as some employees home on an extended break, it's definitely going to be money well spent. But if you need eggs or if you need milk, definitely go out and get it. But just remember, practice social distancing, and also remember to sanitize and wash your hands when you're done. It's little simple things that are going to go a long way with personal protection and neighborhood protection as well.
Is there something in place for people who aren't able to get out? We know Office of the Aging is working with elderly, but there's people who aren't old who still have those issues, disabled, but also just people that are struggling, people struggling with addiction, families that are just challenged in that way.
Office for the Aging and the Department of Social Services are working together for some type of food distribution, meal distribution. We don't know what that's going to look like yet, but if we're encouraging people to stay home, then I think we also, and I think the governor would agree, we have an obligation to try to provide some meals for them while they're at home. Students especially will be taken care of by the school districts. There's, you guys have reported already on that, but there are some efforts that we're making to coordinate our response. The interesting thing about government services is during times of need, like a recession or economic downturn or a epidemic like this, the public need goes up, and at the same time our government resources sometimes get squeezed. So obviously with 50% of our staff going home, we just ask people to be patient. We will be able to handle all of your public welfare needs, but we will be operating with a little less staff. So I would also like to note, we should have put it in the press release, but the elections that are scheduled for Wednesday for the villages of Turin, Lowville, and Castorland.
In Copenhagen.
Copenhagen. Those elections will still be held as of right now.
Nick, let me follow up on the question you asked, Ashley. This whole notion of height. In a week's time, New York City has had a 10-fold increase. So is that when we act, we wait till we have a 10-fold increase? I think this group has been working for a period of time to manage this in such a way so that doesn't happen here. I actually think that's what the public should expect from us, to be planful, science-driven, data-driven, and disciplined. And if we are, with a sprinkling of good fortune, just maybe we won't have a 10-fold increase because of the work of the people at this table. So I have heard those reflections as well. It is a bit frustrating, but why do we need to wait for it to get bad before we respond? And we will have done our jobs if it doesn't get bad. Now, this is a scary virus, make no mistake. And all of what we are doing now may help us not have to deal with the same kinds of issues New York City or some of the other large metro regions are dealing with today as we sit here.
And I just wanted to point out too that just because it was my question doesn't necessarily mean it reflects my beliefs or anything like that, but it is it is a question that we've been getting asked a lot, and I just, I thought it might be helpful for people to hear it from your words. And also I think it's just so much information comes out at the same time, but I think it's just important for people to understand that the reason you're putting these basically, if we don't flatten the curve and we see the big spike all at one time, then that puts a tremendous resource or tremendous impact on the hospitals and what they can handle and things like that. And all we have to do is look at some of the countries in Europe to see what's going on over there for situations like that. So that was the only reason I asked the question.
I also think I've heard the reflections about Albany and the governor. I got to be quite honest. I think they're doing a good job, because they're hearing us after they present an idea or a thought or a direction. So the governor will present the latest information, the thinking of the Department of Health and others, and then we all have resources professionally, like I have Haney's and Iroquois, and then immediately people are evaluating the guidance. And then we have a vehicle to now report back to the DOH through our trade associations. This may not work or be appropriate because of. So I feel as though the governor and his team have been very responsive to those of us locally. And if he wasn't providing this guidance, then there would be criticism, we're not getting guidance. We're getting guidance, we have an opportunity to think about it, talk about it, reflect on it, and then it gets updated later in the day, gets updated tomorrow morning. So I actually think the leadership out of Albany has been very positive, and we are doing things proactively in New York State.
Thank you.
Yeah, I agree.
Having said that, Ryan, is there anything you'd like to say we might be doing in the future but aren't planning to do right now?
Oh boy. I'm sure there are
Homage to the governors.
a whole host of things that we may be doing that we're not currently doing, but nothing that I would like to comment on right now.
And everything we're doing right now is based on no cases locally, or even in the North Country as a whole. I guess one way to ask that question would be, do you foresee if there is a positive case in the county, does that change your guys' outlook, your guys' game plan, everything like that, or are we still in the same?
I think it ramps up the intensity. It certainly sends Ashley's crew, working on those investigations like we talked about before. But the important thing in all of this is the social distancing right now, and these departments being closed, the DMV being closed, some of these things, the bars and restaurants, these are minor inconveniences, but really you have to think about our most vulnerable, members of the community, the elderly, the sick, those with, immune systems who may be compromised in one way or another. So if we can, as leaders, I expect all of our county employees to be leaders in this. If we can help lead the effort on social distancing, and as you've heard from the experts, it is important and it does work, then I think these minor sacrifices can go a long way to protecting the most vulnerable in our community. So
Every day I provide an update to the Board of Managers, and it starts off with something like, this remains a very fluid activity. And it is very fluid. And then somewhere in the second or third paragraph, I remind them it's not if, it's when. And because you don't have to look at a map and see, it's all around us. And I know Ashley's team has been right on top of it, and the rest of us will be there to support Ashley and her team when that one comes. It may mean we do services differently at the hospital, so they have a resource immediately. We don't know yet today what that looks like or what it means, but that's how we have to respond.
That actually is something, Ashley, we were able to speak about a little bit. Right now, you're doing well, and luckily we have a state where there is good guidance coming out and punctually, as you were just saying, but may there come a time where you have to be a little more specific and go out on your own limb, all of you really, to come together and make decisions where perhaps state guidelines aren't really tailored for Lewis County's context? Are you able to do that? Are you able to, or do you have to kind of stick with the state the way things are structurally? Do you see what I mean?
Yes. So with how rapidly this situation is evolving, the state, as far as local health department guidance, has had a hard time keeping up with, the level 3 countries, level 2 countries, and where are you most at risk because it's spreading. So they have empowered us to make those local decisions if we don't have clear guidance. But they've done a wonderful job supporting us. Conference calls every night to try and answer our questions. So they're doing a good job, and we are responding appropriate locally.
Are you pacing yourselves? I know you worked all weekend and there's a lot going on, but like you say about the entire healthcare system and their staff, we need all of you also and your teams. Are you all pacing? Is there enough that everyone can balance?
I can't comment on our healthcare staff, but I would say that responding to public need during an epidemic is why we have government. That's what we're here for. This is why we became public servants in the first place. So we'll be fine. We'll be here, and we'll be serving the public for as long as we need to. I can't comment on the healthcare because that is a little bit of a different situation. But.
So at public health, we have somebody that's in charge of employee health, safety, and well-being. Because when you are in this mode, that is something that may be put on the back burner. So we are constantly evaluating this, and that's part of our staffing plan, is making sure that individuals get breaks, because they're important. We need to take care of ourselves in order to take care of the community.
Even civil servants need sleep, not for nothing.
Yes.
I know in the hospitals.
Yeah, I think it's just simply acknowledging that people are working hard. We all have to go above and beyond because it's what we have to do. And every opportunity we can say thank you. We say thank you. And the schools were closed today. We thought it was going to happen, so a week ago we started planning for it. And last night I was feeling some anxiety in my sleep. Are we going to be able to staff? The team came through with flying colors. We were appropriately staffed today in all of our services. So, when it comes down to meeting the needs of the community, of our neighbors, of our family members, folks do step up, and it's part of what makes it special to work here.
Absolutely, and actually that brings to something that came up in today's formal doctrine. The fact that he really wanted, and for good reason, he wanted there to be in place some sort of childcare, some sort of backup for parents that are working, two working parents or one parent, that now these kids are home and they have no one to look after them. Not everybody has grandma in the background, right? So it seems from the press release his office sent after the press conference that it's required in downstate areas where they actually have large outbreaks and so a large number of people needed. It doesn't seem like it's required in this part of the state. However, we're always talking about child care challenges. In Lewis County, there's not enough, and there's not going to be enough in a situation like this, most certainly. Has there been thought given to that yet? What to do to help parents that need to still work and have kids home?
We have been in conversations with Hand in Hand specifically, that is our largest daycare provider. Nothing formal decided upon yet, as guidance is coming from the governor's office in regard to who can remain open and who needs to close. So I would say more to come on that, but that is an absolute concern of ours, especially with the healthcare workers. So that is something that we're working on.
We've actually had some churches reach out too and say that they were trying to set up some kind of daycares and things like that in their facilities, but we're waiting to get some more guidance on gathering sizes and things like that.
We've got more anecdotal stories of individual communities stepping up. We do have, even though school-age kids are home, teenage kids are home as well. So there is an opportunity for some babysitting. Some schools have coordinated some matching services of high school kids with elementary school families for some child care services, but nothing that's very grassroots, nothing from the top down at this point.
I think we need to understand what the data is telling us. So this morning at our meeting, I asked our Director of Human Resources to create an inventory of all of the formal daycares, and we've also been in touch with Hand in Hand, they have been with us, as well as the informal. And through this process, an example of it having, I think, some interesting success, we got a note from a staff member who said, I have 2 teenage daughters, I need them to be able to do something for the next 4 weeks. We'll have babysitting opportunities. But in order to get our arms around that, you need to categorize it, organize it, understand, and make sure the appropriate safety things have occurred in training and that sort of thing. So it is starting to happen.
Makes sense.
Could you just talk a little bit about with visitation being pretty much halted at the nursing home, group activities have been stopped at the nursing home. Can you talk a little bit about, are you guys implementing any measures there to kind of keep the residents, make sure they're getting some contact with people on a day-to-day basis and just kind of some engagement time?
There are 2 things. The social activities team is at full strength and really looking at individualized activity programming. The other thing, the last time I was part of a natural disaster was the ice storm, and there were restrictions. We didn't have FaceTime back then. So maybe families can't visit, but through technology, they can visit. And our nursing home administrator is really working hard on facilitating that with our activities coordinator. So with a little bit of planning, a little bit of engagement, we have opportunities to do those kinds of things. And we began talking about that last Friday, and I have not yet received a single complaint. Now, that's a measure of some success, but we probably aren't doing it as nearly as much as we want, but people are working towards that end. Technology will give us some flexibility around social programming and activity that wasn't here in the past.
And do the residents have access to tablets and things like that through the hospital, or is that something through the nursing home, or is that something they need?
A few have their own, but yeah, we have all of that to make that possible.
Okay, perfect.
We have cell phones and tablets and laptops and all the things that you find in people's homes today.
Yep. That was
Until I walk out of the
Ryan's
hall.
question. Yeah, I'm good too. We appreciate you guys taking the time today, and thank you.
A lot of time. Thank you very much.
Thank you for all your hard work.
Thank you.